to the dentist and I thought I want to be comfortable, and I remembered my fabulous Bhutanese men's outfit that I got. And the way men wear it is very different from how I'm going to wear it. They sort of do this very clever technique. They pin it around the back, they hoik it up, they hoik up the front, they get this big pocket. I can't do that this morning, but this will allow me the freedom to just breathe. Belt, the silk belt, I don't know where I got the silk belt from, which I will not have on the tightest setting. And I've got my COS merino wool jumper underneath and tights. So super, super comfortable, and the most beautiful fabrics. This is £28 in Bhutan. Just so I'm in the loo, dreading going in. I put my COS coat on top of that outfit, and I love the volume here, it's great. I don't know why I'm so nervous of the dentist. Any kind of dentistry freaks me out, and I did write a book called Fearless, but the dentist is another realm altogether. Anyway, let's see what it's going to be like.
Okay.
Dr. Ian's got the results in synopsis. What's
Yes.
important for us to know, because I am a postmenopausal woman too.
Right, so the main thing is gum disease is always multifactorial, and it's a pretty unfair condition. So genetics plays a big role in this. The menopause is a really big risk factor because of any hormonal changes, pregnancy, menopause, the whole thing. Also other things like smoking, stress, all of those things can have a role. Of course, home care is a part of it, but it's actually a small slice of the pie. There's lots of other things going on. And what we're checking for are gum pockets, and that's when the gum loosens up and you get a space between the tooth and the gum. And that's a problem because bacteria can go inside the pocket, start attacking the jawbone, and here you can see the bone levels as started, and particularly around these lower front teeth, we're sort of lost about half of the bone essentially. Sometimes from the outside you can't actually see that you've got gum disease, so the pocket measurements and the actual bone levels are super key.
Bottom line is this: if I had waited another year, I could have started losing teeth.
Yeah, you definitely start to see the signs, and it's hard to say how rapidly things will progress, but yes, it's time sensitive, you want to treat it straight away.
I'm really relieved I'm here now. I'm going to do whatever it takes, and I've got to stick to it, because this is that wake-up call I need. And we discussed earlier how gum disease can affect your whole body and other things going on. So dreading but relieved in equal measured. Let's get on with the treatment.
We've just finished the treatment under the gum, which we disinfected the pocket. A lot of called biofilm or calculus, scar tissue, the body trying to heal. So we removed all of that under local anaesthetic, and hopefully it wasn't uncomfortable. And now we're going to let it all heal up.
So I can't close my mouth. She did you did an amazing numbing technique, which wasn't those horrible injections, it was something else. I also did make the mistake. I brought what I thought was half a Valium, but I took half a sleeping pill. I think that helped. But we got through it. The relief, I cannot tell you. And I'm so glad you found everything under there I thought was under there. It's now about home care, which I'm really mad about. And you just said one statement to me.
So it is literally 80% about what you do at home and 20% about what we do. So if you don't do it, you have to go and think to yourself, my teeth are going to fall out. So you have to force yourself, like any other habit, to do the routine, which we're now going to go through.
Yeah. Okay, I'm going to listen to everything you're going to say.
So the three key things are brushing with an electric toothbrush, but brushing properly.
I don't know how many people know how to brush their teeth. It should be something you should say to a 5-year-old, but show me, because I never think I learnt it. Yeah.
Firstly, electric brush is a million times better than a manual brush, but the key thing is how you use it. So it's doing the work for you. You need to hold the toothbrush half on the tooth, half on the gum, not just on your teeth, because where the bacteria get trapped is along the gum line. So that's got to be clean. So you hold it like that, push it down towards the gum for the lower teeth, and up towards the gum for the upper teeth, and you're holding it 1, 2, 3, 1, 2, 3, 1, 2, 3. But it's like massaging the gum. You have to clean in between your teeth, otherwise you're missing out basically half the surfaces of the mouth. So incidental brushes are your first option. They've got to feel snug, otherwise they're not doing anything.
I'm realising how important it is the right colour.
You can see when I use the blue one, it's quite loose, really nice and tight. So like the yellow fits really nicely.
Yeah. At the top, I do. My teeth are bleeding now because we just did the
which is normal. That will stop once things heal up.
Okay.